All right, so hello and welcome to this information session offered by the Department of Population, Family, and Reproductive Health at the Johns Hopkins Bloomberg School of Public Health. My name is Sally Safi, and I'm the Director of Graduate Studies in the department. We're really excited that you have joined us today to learn about our department, the programs we offer, and in particular, how our students are engaged with the work of our faculty in the department. I'm going to give a very brief introduction to our department, and then we'll spend the bulk of our time today together hearing from our current students and faculty about their research. They'll discuss projects on which they collaborate to get you a sense of opportunities here beyond the classroom that are available to students. After we hear from our student and faculty pairs, the education team, including myself, will stay on the call and share some information about our degree programs and answer your questions, or as many as we can. So the Department of Population, Family, and Reproductive Health is one of 10 departments in the School of Public Health here at Hopkins. The department has a long and rich history. Decades ago, the Department of Population Dynamics merged with the Department of Maternal and Child Health, and we became the Department of Population, Family, and Reproductive Health. So the work of the department is very diverse, but we are all united in our focus on promoting health and well-being across the life course. We use a multi-level life course framework to understand public health issues and the interplay of biological, behavioral, societal, and other factors across a person's life and across generations. So this framework helps us to advance health equity through effective public health research and practice. Students in the department select an area of interest within PFRH to sort of drill down on a focus area, and these four areas are shown on this slide. But in practice, there's a lot of overlap in these areas. Courses we offer fall into multiple categories. The work that our faculty do does not often fit neatly into just one of these boxes. And rather than constrain students, these areas are meant to help guide students in the selection of coursework and help students refine interests as they are here studying public health. So today we're going to focus on projects that align most closely with women's sexual and reproductive health, though I suspect that we will see themes from other areas in what we discuss. So like I said, at 11:30 our time, Baltimore time, we'll turn to discussion of PFRH programs and the application process. But right now, I'd like to turn the discussion to our student and faculty pairs. I'm going to stop sharing my screen in just a minute. I'm delighted to first welcome Haley Thomas and Dr. Suzanne Bell to kick off our discussion. So let me stop sharing my screen. And to kick us off, Dr. Bell and Haley, could you please introduce yourselves and talk a little bit about your research interests and expertise?
Yeah, thanks, Haley. Thanks, Sally, and welcome, everyone. I'm an assistant professor in the Department of Population, Family, and Reproductive Health. I'm a demographer. I'm committed to improving understanding of fertility and related behavior at the population level and to identifying factors that contribute to disparities in achievement of reproductive goals. And specifically, my work examines patterns of induced abortion, contraceptive use, and infertility. Go ahead, Haley.
Okay, great. Thank you. My name is Haley Thomas, and I'm a third-year PhD student in the department. My official area of interest, defined by coursework in the department, as Sally just mentioned, is women's sexual and reproductive health, and my methodological training has been in epidemiology and demography. In my research, I explore the social and interpersonal factors that influence sexual health, reproductive health, and childbearing trajectories using both quantitative and qualitative methods. More specifically, I'm interested in how partners and other actors, like family members, influence sexual and reproductive outcomes such as sex, contraceptive use, and abortion by using violence or coercion. I'm currently working on my dissertation, which is exploring the relationship between infertility and intimate partner violence and related help seeking among women of reproductive age in Kenya. And I'm co-advised by Dr. Suzanne Bell and Dr. Shannon Wood. Outside of my dissertation work, I work on the Performance Monitoring for Action project and am affiliated with the Center for Global Women's Health and Gender Equity and the Hopkins Population Center. Thank you.
Great, thank you so much. So we would love for the two of you to share a little bit about one research project that you have worked together on. So could you describe a research project, talk a little bit about the roles that you have and how you work together?
Yeah, so Haley and I have worked on a number of projects from the time that she started her master's in the department, and now through the first few years of her PhD program. And I'm going to talk about, and Haley will expand on this, our collaboration on a project that I'm leading around infertility in sub-Saharan Africa. As I'm sure you all can imagine, having a child is a really fundamental human experience, yet the extent to which people and couples in low and middle income countries experience infertility is a really neglected area of sexual and reproductive health research, particularly in this setting. And women experiencing infertility are often blamed and can suffer myriad psychosocial, psychological, social, marital, and economic impacts, which can be exacerbated by infertility stigma. And so I have been leading a 5-year study that seeks to improve the field's understanding of infertility levels, associated stigma and fears in sub-Saharan Africa, with a focus on Uganda. And this work has leveraged on existing longitudinal data of reproductive age women in Uganda. And we're seeking to specifically improve population level infertility prevalence estimates qualitatively to investigate women's and men's perceptions, fears, and experiences of infertility and related stigma. And then using this information from the qualitative data to ultimately develop and validate a multidimensional scale of infertility stigma and fear among women. And Haley will talk a little more about the roles that we each play and how we've collaborated on this work to date.
Great, thank you. So Dr. Bell is the principal investigator, or PI, of this project. So she conceptualizes all of the research questions based on gaps in the literature and creates the analytical plans. For all our publishable manuscripts, she is either the first author or last author. So if you all know what that means, she either contributes nearly all of the writing, or she outlines how we'll be framing a paper for others to contribute to the writing. As her RA, I either carry out full analyses based on analytical plans she has set, or we divide up the analysis. In both cases, I provide her with frequent updates and results, including any questions I might have. And then she provides direct guidance on specific questions, or we chat out a plan together for moving forward. I also do a bit of writing on this project, and Dr. Bell provides guidance on sections as I draft them, which has really grown my skills as a scientific writer. And because we have been working together so long, I think our collaboration has shifted in time. So she's really trained me to be a more independent researcher. But all that to say that we meet weekly, so our collaboration is quite robust or consistent. So we do have weekly meetings, and we also frequently email or Slack each other between those meetings to make sure that if there are any hiccups or questions, we can make sufficient progress before the next meeting. I don't know if we want to go into more specifics than that, but that's in general. Dr. Bell, if you have anything you want to add.
No, I think that's a great description. And Haley also works closely with me in the context of our broader collaboration on this project with our co-investigators and co-PIs in Uganda. So that's Frederick Makumbi and Simon Kabira.
Thanks so much. I think that was a really helpful description of both the research that you're working on as well. Thanks, Haley, for that specificity in the details of like your roles and how things have evolved as you have been here as a student, and appreciate all of Dr. Bell's mentorship for Haley and other students. So I hope that gives our attendees a bit of a sense of how students engage with faculty and specific roles and what that can look like. I'm going to turn to another faculty student pair in a couple of minutes, but I did want to give Dr. Bell and Haley a chance to talk a little bit about the public health impact of your research. Could you share a little bit about that?
Yeah, so I highlighted some of the specific aims, but the goal broadly in relation to this project is to bring attention to the issue of infertility, specifically in Uganda, but we are providing population level estimates in several other sub-Saharan African countries as well, and highlighting not only the extent of this reproductive health outcome and related patterns, and we're seeking to better understand how infertility related stigma can how it manifests in this context, with the hope that these findings will inform policies and programs ultimately to reduce the extent of infertility and the associated negative repercussions. And this research is also going to lay the groundwork for future methods, longitudinal study of infertility, related stigma and fear, and their impacts in sub-Saharan Africa to further inform policies and programs that are seeking to address infertility in the region.
Great, thank you so much.
You
Yeah,
wanna
that's,
that's good.
yeah, Haley, do you want to add anything or?
I guess I'll just say for me, one of the important things of this project is historically in sub-Saharan Africa, a lot of public health work has been focused on limiting the number of children that people have. And I know for me and Dr. Bell as well, reproductive justice is a really important aspect of our work. And so thinking about the right to have children and addressing infertility is really important. And I think a new area that the field is going. So I'm really excited to be involved in this work.
Thank you so much. So we'll have a little bit of time to ask some questions about this research project, but first I'm going to introduce our next student faculty pair. So I'm very pleased to welcome Elena Garcia Farinha and Dr. Carolina Cardona. Would you like to introduce yourselves?
Thank you, Sally. Very nice to meet you all and very excited to be here talking about the work we do in the department. I'm Carolina Cardona. I'm an assistant scientist in the PFRH department, where I obtained my PhD in 2022. I'm a health economist by training, and my research is primarily centered on the field of economic demography, with an emphasis on investigating women's health across the life course. Most of my work has been focused on better understanding women's sexual and reproductive health behaviors and identify the factors that influence these behaviors. In a lot of my work has been mainly focused in the context of low and middle income countries. Elena?
Yeah. Hi, everyone. My name is Elena. I'm a second-year master's student in the department, and I'm specializing in women's sexual and reproductive health with certificates in maternal and child health and public health economics. And I've been working with Carolina on a project in family planning in Bolivia specifically.
Great, thank you. So, could the two of you talk a little bit more about that project?
Yeah. I can get us started. So essentially, we're looking at Bolivia has been chosen as a global exemplar in family planning for their increase in modern contraceptive uptake and their decrease in inequities throughout the past 30 years. And I'm going to speak a little bit to the opportunity as a master's student to collaborate with faculty on the project and sort of the takeaways and the opportunities to apply some of the skill sets that I learned through my first year in the master's into this project. So essentially, I got the opportunity through Carolina to work on the qualitative aspect of this project, leveraging some of the work that I had done prior to joining the master's in qualitative interviews, and additionally, my qualitative analysis skill sets that I developed throughout my first year. And one of the the amazing parts of the master's is the opportunity to pursue field work and a master's essay as part of the 2-year MSPH program. And Carolina actually was first my advisor. For master's student, you'll be paired with an advisor. And the great part is just that I was able to share my interests with Carolina in particularly like women's sexual reproductive health, focusing on the Hispanic population. And through our connection and through the department and leveraging the skill sets that I had developed is how I was able to land this opportunity. And Carolina can speak a little bit more to like the broader context of the project.
Thank you, Elena. So as Elena was sharing, I was assigned as her advisor, and based on her research interest, I thought that she would be a perfect research assistant for this project, mainly because it also required someone to speak Spanish, because she was going to be working as a research assistant on the qualitative component of the project. And as she was explaining, the intention is to identify the factors that made Bolivia an exemplar country, meaning that what were the drivers that increased this contraceptive uptake in the country, given the level of development. And the most important part of this project is what are the lessons that can be learned of the progress that has been conducted over 30 years, and how we can apply those learnings into other contexts of low and middle income countries. Most of the countries that have been selected are in Africa, and Bolivia was the only country selected from Latin America, which is at a different stage of their demographic transition. So it really became a very interesting case study from which other countries that have a higher fertility rate can learn some of the lessons. So Elena was part of the qualitative component, but the project also has other components that look at a quantitative data analysis and also a desk review of the policies and the financial aspect of and the financial landscape of the country. So that's just a big overview of the project.
Thanks very much. Do you have anything you want to share or add about the public health impact of the project that you're working on?
Definitely.
Go ahead.
I think the most interesting part of this project is that through a quantitatively approach, the Gates Foundation was able to identify a group of countries that were exemplars, as they call it, because they did something marvelous that, given their level of development, were able to progress more than other countries. For example, in the case of Bolivia, their average annual rate of growth over the past 30 years was an increase of 5 percentage points annually, which is a pretty large increase in both modern contraceptive prevalence rate, but also in demand satisfying for modern contraceptives. So then the key question is, what are the drivers that led the country to such an increase? And something that we identified through the qualitative work that Elena was conducting is that one of the key aspects of it was the financial sustainability that the country was able to achieve by no longer relying on donor support for the financing of contraceptive supplies, which is a mechanism that can be better understood and followed, and then could also be applied to other low and middle income countries that still rely highly on donor support for the purchase of contraceptive supplies.
Thanks. Elena, would you like to add anything?
I'm happy. Yeah, I can add as to sort of another one of the interesting parts. So Carolina was talking more sort of we conducted two types of qualitative data collection. One was key informant interviews with sexual and reproductive health experts, policymakers in Bolivia, and the other one was with the community. So we were able to see the impact of women's empowerment, even when Bolivia has like very marked geographical differences as a country, and that those followed the modern differences in modern contraceptive prevalence rates. And it was interesting to see and get the opportunity to learn through essentially this qualitative data, like the degree to which women's empowerment had an impact in the use of modern contraceptive, even amongst regions with like lower MCPR rates and lower acceptability as like due to community factors, religion, et cetera, et cetera.
Thanks. So I hope for our attendees that this overview, it's a very high level overview, but I hope it's given you a sense of the work happening in the department, and again, how students are involved in faculty projects and how they have grown as public health researchers and professionals by having these hands-on experiences. So we are going to have a few minutes for questions. So if you have a question, we would love for you to come off of mute and ask, or you can type it in the chat. But first, before we turn to the Q&A, I would love for our attendees to a little bit of a change of pace away from the academic and professional experiences and more to maybe like the personal experiences. Maybe if you could share something that you really love about being a member of the department, or if you want to share what you enjoy about Baltimore. I'll start with Dr. Bell.
Sure, thanks, Sally. So I did my PhD in the program. I started in 2014. So I've been at Hopkins in PFRH for over a decade, and many of my colleagues were colleagues or advisors while I was a student, or were fellow students in my cohort. And it has been, a real highlight and amazing aspect of the PFRH department, the extent to which these people have become close friends and an extension of my community in the Baltimore, DC area. I actually live in DC, and multiple of us have had kids around the same time. And it's just so lovely to have that merging of kind of professional and personal friends in my life. And I am grateful to PFRH for being central to that.
Thanks, Suzanne. Haley?
Yeah, I agree with that. I did my master's at Hopkins and loved it so much that I wanted to stay and continue working with Dr. Bell and Dr. Wood. The people that I've met in this program are some of my best friends. We all live together in like a 1 mile radius, essentially. They were witnesses at my wedding. I feel like this is just a really tight-knit, collaborative, loving community. So yeah, my best friends in life are from PFRH, and I also really enjoy Baltimore. It's called Smaltimore, if you don't know. So you see the same people at the gym and at the grocery store and around the park. And that's just really lovely.
Thanks, Haley. Dr. Cardone?
I'm just going to echo Suzanne and Haley, and I've also been at Hopkins for almost 10 years now because I did my master's and the PhD. Before I was in the IH department, but then for the PhD program, I switched to the Pop Fam department. And I do have to say, like, I have the same feeling that something I really like about PFRH is that it is a small department. And it might be because it's a small department, I can say that we know all each other, including students and faculty. And we do have a tight network of support. For example, I'm going on maternity leave in about a month, and I already have friends that are colleagues and friends that have already stepped in and said, like, I can cover you while you're on maternity leave. So that's something very nice to have within a community that is part of your work. And as Haley was saying, Baltimore is also a very nice place, that it's a small one that you can run into each other at the grocery store or at Patterson Park or the different locations around. And people do live in a 1 mile radius around the school or Fells Point or that area.
Thanks. And Elena, I'll turn it over to you to close out this conversation.
So, yes, happy to chime in as the person with the least amount of time in the department and in Baltimore. I echo what has been said. It's been a super welcoming environment. Like, again, it was my first time coming to Baltimore last year. I've met some wonderful people in the department. I've had the opportunity to build these connections with faculty that have led to field placements and amazing opportunities. And yeah, the sense of like friendship has really been developed within my master's cohort. And I also like Baltimore. It is a small like neighborhood feel, which is interesting for a city as diverse as Baltimore is. And I like that it has also access to a lot of things. Like, even though it's small, you have a big like sports scene, you have a large entertainment scene as well, decently large. And I also enjoy how close it is to other places, as Dr. Bell was saying. It's close to DC and also New York City and other Northeast cities. If people have like loved ones spread throughout the US, it's very helpful also having a big international airport.
Thanks so much for sharing. All right, we have about 5 minutes for Q&A. Again, at the half hour, we will ask our faculty and student guests will leave the meeting, and we'll turn just to some specifics about the various degree programs that we offer. And if people have questions about applying in admissions, we can turn to those. But for now, we would love to make the most of these last 5 minutes with our panelists and open it up for a couple of questions. If there are, go ahead, Cecily.
Yeah.
Mhm.
I was curious, kind of for all of the people in attendance, but a lot of the research that I'm hearing from you guys and other academics in this kind of niche are conducting research outside of the US. And what I would like to do in my PhD career is look at US demographics. And I was just curious if there was space for that here. And if you could speak on any projects that are currently being conducted on kind of US community-based research.
I can talk about, I just highlighted one project that I'm leading currently, which is internationally focused, but my other 2 projects are looking at evaluating the impact of recent abortion bans on demographic outcomes, specifically fertility, infant health, and maternal health outcomes. And there's a lot of other research led by faculty in the department on domestic issues as it relates to population, family, and reproductive health, including some community-based, community-led collaborations.
Thanks. I'll echo that. We will have another info session in January, and we'll have some more domestic projects highlighted during that session, I think. But the work of the department, I think often students feel like they have to sort of choose between domestic or international. And I think that a lot of people, once they come here, find that they don't necessarily need to choose. And you will meet professors like Dr. Bell who are doing work both here in the US and abroad. And so you don't necessarily have to choose. But definitely have a lot of domestic projects happening for those who are interested in that.
Mary Alice, maybe you can put the links to the current research by area.
I'm laughing because I'm like getting it all ready to put it in the chat.
Just-
I'm about to drop a page
Perfect.
on our website that lists all of the projects that I think will help Cecily for your question as well. Thanks so much, Suzanne. Great minds think.
Thanks. Let's turn to Rayan's question.
Thank you so much. Also, thank you for the opportunity to talk with all the teachers and also current students. I would like to ask Carolina. I'm from Chile, and the problem here in Chile currently is that we have a high rate of C-sections, and I was wondering, because you talk about like an economic part of like kind of research. I was wondering if the kind of research you do could help me to, for example, identify how much money does the government of Chile spend, like overspend on unnecessary C-sections performed in my country, and how, and maybe some kind of interventions that could be economically viable for Chile's system.
Hi, Ryan. Thank you for asking that question. I think one of the advantages of being a former student from Hopkins is that I also know the curricula of the classes that can teach you those kind of skill sets. And in the department, but also at the university, we do have a set of classes that can help you answer those research questions. For example, there is an economic evaluation course. There's also a course on financing, and those would help you to better understand those patterns. And one of the advantages of those courses is that it is not just something that can be applied for one country or one specific context, but it actually walks you through on how you can do this for any different type of context and how you can collect that data to better understand those types of pattern or processes. And in the department, we do have a track or a concentration, or we do have like a set of people that do work on health economics, and I'm one of those. And Elena is also someone who has benefited from the certificate program that she's currently pursuing as a master's student.
Okay. Thank you so much.
Let's take one more question, Rajani.
Hi. So my question is a bit more general because after hearing all of you talk about research, I was just wondering, like, since my question is very opposite to Cecily's question, actually. So since it's based, the most researches are concentrated outside of US in like mostly low middle income areas. I was just wondering, like, what are some challenges, some specific challenges you guys might have encountered in data collection, if there's any, and if there's any memorable challenges, because I believe there must have been like a few challenges for data collection. So I was just wondering if there's any and how you tackled it, or yeah.
Yeah, I can start with an initial response to that question. I think it's really important in all this work we do in other regions of the world that we have really strong collaborators from the local countries where we're implementing these surveys or doing related data collection. And that's something I know Carolina and I have both benefited from through the Performance Monitoring for Action project, which is a multi-country study of family planning and reproductive health outcomes. One thing I'll highlight specifically is a lot of my work in the context of the PMA project was actually focused on abortion. And that's a really challenging outcome reproductive health experience to measure. It's highly stigmatized. It's illegal in both of these, in most of these contexts. And the language used to talk about and describe this experience can be quite stigmatizing. And so we worked closely in testing out different languages and kind of cognitive interviewing with potential participants in the countries where we've done this work on abortion measurement to make sure that we are using the right phrases and terms, and we have a kind of shared understanding of what it is we're trying to measure. And those questions and the way that we approached asking about this outcome changed a lot based on this initial testing and piloting and cognitive interviews and in conversations with our collaborators and data collectors in country. So I think that's a real benefit to our strong collaborations.
Thanks so much. So with that, I think we are going to end this portion of the session. So a huge thanks to our panelists. I'm very grateful that you came today and shared a bit about your work and your partnership with each other. So thanks so much for coming. You're welcome to stay on and learn about our degree programs, but I think you know all that info already. But a huge thanks. And if anybody else wants to join me in a virtual round of applause. But thanks so much, and feel free to hop off. I'm going to turn now to sharing some info about our degree programs and admissions, and we'll try to save some time for questions as well. So let me share my screen. Mary Alice, are you seeing my screen?
Yeah, you need to get in, you're in some sort of presenter mode.
Is that better?
Perfect. Yeah, you're good.
Okay,
You're good to go.
great.
Yeah.
All right. So so now it's flipped on my screen. So apologies, I will not be looking directly at the camera. But we have, so let me zoom out a bit. So just a reminder, we have been talking about work in the Department of Population, Family, and Reproductive Health. That's one of 10 departments at the School of Public Health. So I think some of you may be interested in degree programs in other departments or even school-wide programs like the MPH program or DRPH program. So I'm presenting here specifically about programs that are within the department. We have 2 master's programs and 1 doctoral program. We have a Master of Science in Public Health, which is on campus here in Baltimore, takes 2 years to complete. We also have an MHS degree, and that can be done either on campus full-time, it takes 1 year to complete, or you can do that program in up to 3 years on an online part-time basis. So that might be better for working professionals, people who want to take it a little bit more slowly. And then we have a PhD program, and that is on campus full-time. We'll talk a little bit more about the funding, depending on people's interests in the audience. But for the PhD program, folks need to be here for at least 1.5 years, but many people stick around Baltimore throughout their entire degree program. So for example, Haley, who's been in the program for several years, is still here in Baltimore. So I'm going to get into details of these specific programs. Again, our MSPH program is 2 years, and students complete coursework in biostatistics, epidemiology, research ethics, as well as 5 competencies that are specific to the department. All of our students in the MSPH program complete requirements that are required by the Council on Education in Public Health. So any school of public health in the US that is accredited as a school of public health, all the students complete these requirements. And then after about 1 year of intensive coursework, then our students turn to completing the field placement. And so that's in the summer and fall of your 2nd year. And students, some stay in Baltimore, some travel, some do a combination of both. But that is an opportunity to get the more hands-on experience, either with faculty here in the department or with an organization in Baltimore or somewhere else in the world. And then students return to full-time coursework in the spring and complete a master's essay. Often that essay is related to a student's field placement, but it doesn't necessarily need to be. So that's an opportunity for students to explore an additional topic of interest and do a presentation as sort of the culminating experience as a master's student. So here's a little timeline of when students complete those requirements. Again, 1 year of coursework, then summer and fall of a field placement, kind of working, not taking courses, and then returning in the spring to take courses and do an essay. Our Master of Health Sciences, it has some similar requirements to the MS-PH degree, where we think about the MS-PH degree as more of like a professional degree. Sometimes students continue in academia, but not necessarily. The MHS is more of like an academic research degree, where students are continuing down a path of research or being in academia. So in addition to completing biostatistics, epidemiology, and ethics courses, our MHS students also have 5 PFRH competencies where you can focus on your area of interest. Remember those 4 buckets that I presented earlier in the presentation. And then our MHS students also have 2 research competencies. So we make sure that our MHS students are getting that additional training that our MS-PH students don't necessarily get related to conducting research or analyzing data. There's some of those CEPH requirements again, and then our MHS students also do a master's essay presentation. So again, just comparing our different master's programs, if you want to apply to the MHS program, you do need 2 years of full-time work experience to apply. That's not true for the MS-PH degree. We have a lot of students come straight from undergrad. Again, the MHS is a little bit more flexible because you can complete the degree either in person or online. You have these additional research competencies that the MS-PH degree doesn't have. Our MHS students do not complete a field placement, and it is a bit shorter. Turning now to our PhD program. We have our PhD students select both a content area to focus on. Again, those are our areas of interest. We have population and health, child and adolescent health, women's sexual and reproductive health, as well as maternal, fetal, and perinatal health. So our students really focus on one of those areas within PFRH, in addition to getting the training in life course, pop change, and demographic methods. And then our PhD students focus in on research methods. So biostatistics, so a couple of epidemiology methods courses, and then some coursework focused on study design, measurement, data analysis, as well as research ethics. Our PhD students engage in seminars. The first year is really focused on just getting oriented to the school and the department, thinking a bit about your research identity and your research goals. Then in the second year, you turn more to analyzing published research, and then you take a comprehensive exam in the winter of your second year, and then the seminar in which you participate shifts to developing your proposal for your dissertation. So those requirements here are just outlined in a little bit of a different way. In terms of the first year and a half is really intensive coursework. Then you have a comprehensive exam the winter of your second year. That's when once you successfully complete that exam, students shift to proposal development, take a couple of exams at both the department and school-wide level, demonstrating that you are ready to engage in independent research. And once you pass those exams, moving on to your dissertation. I do want to mention that we have those 3 degree programs, but we also have certificate programs here in the department. So many of our degree seeking students will complete 1 or more of these certificates. The certificates listed here on this slide are offered by the department, but there are a zillion other certificates offered by other departments in the school. And so you can, once you get here, you can decide if you really want to focus in on some of these areas that are a focus of our department, or do you want to seek complementary training and maybe get a certificate from a certificate offered by the epidemiology department or the health, behavior, and society department. So that can be a really great way to select electives because you will have room in your schedule to take additional courses beyond what is required. Very briefly, application deadlines. If you are thinking of applying to the PhD program this cycle, I hope that you are aware that the application deadline is December 1st. So that is rapidly approaching. If you're interested in a master's program, our deadlines are a bit later, although we do recommend that you apply as early as you can. So we have received a number of applications for this cycle already, and admitted students, we notify students of the admissions decision as soon as we make it. And then our scholarships are awarded to qualified applicants as they apply. We haven't quite started doing this yet, but we will in the next few weeks. So if you are interested in being considered for a scholarship, apply early because before the scholarship slots are filled up. We do have a school-wide scholarship this year. It is a need-based scholarship. And so if you want to have the best chances of being considered for that scholarship, please apply by February 15th. If you are an international student, we ask that you apply by May 1st because there can be some additional logistical issues to work out as an international student. But the application closes for good on June 1st. But please apply early. We would love to stay in touch with you as you are applying, making decisions about applying, or making decisions to come here if you're admitted. So we do have another virtual info session on Thursday, January 23rd. It will be very similar in format to this session, and we will talk with some faculty and students who are doing work related to child and adolescent health. So we'll send this information out. We'll give everybody here who registered these slides as well as information about this virtual info session. And then if you have questions, you're welcome to reach out to our wonderful academic program managers. So their information is listed here. And so with that, again, I'm going to stop sharing my screen and we'll take whatever time we have left to answer questions. I imagine that there are many in the chat. Just give me 1 second to get situated here. So while I'm looking through the chat, Rayan, do you want to ask your question? I see your hand up.
Yes, thank you. So I didn't get that in the deadline dates. There were, because you said that PhD deadline application was December the 1st, but
Yes.
then for international students, it said
For
May?
international, no. So if you are applying to the PhD program, whether you're an international student or not, it's December 1st. There are some different deadlines for the master's programs. So let me just restate those deadlines. If you are applying to either the MS-PH degree or the MHS degree, you technically have until June 1st to apply, but we really recommend and encourage you to apply as soon as you can. If you're an international student, we really recommend that you apply no later than May 1st. But again, to be considered for scholarships and to have the best chance at both department and school-wide scholarships, please apply now, and we will consider applications on a rolling basis and notify people as we make decisions. Is that helpful?
Yes. So
Okay.
PhD is on December the 1st.
Yes, PhD December 1st. Yep.
Okay. And I was also wondering, because it is such a competitive program, if you have like maybe requirements in order to know if I could be a potential candidate or not to apply.
In terms of, so for the PhD program, it is super competitive. You're right about that. We have some FAQs on our website that we can send out, and that talks a little bit about what makes applicants competitive. Generally, people admitted to the PhD program do have a master's degree in public health or a closely related field. It's not an absolute requirement, but typically students who are admitted to the program will have a master's degree. We like to see that students have some research experience, because you are committing to a program where you are going to be trained in research. And so we want to know that like you've tried it out and you're confident that that is what you want to pursue. We look at your personal statement, your letters of recommendation, your past transcripts. So we're looking for strong previous academic performance, letters from both academic and professional supervisors or advisors who know you well and can speak to your research ability. We want to see that you have some refined interests, but we definitely understand that people in the program are still exploring, and that's okay. So you don't need to come in with a dissertation topic, but you should be able to sort of articulate what research areas you are interested in, and potential areas that you want to grow and explore in the program. I'm going to turn to some questions in the chat, and I see a bunch of people have their hands raised as well. So there's a question about the 2-year work requirement. That is for the MHS program. So the MHS program does have a 2-year work requirement, but we have another program, the Masters of Science in Public Health, and there is no work requirement there. So you're welcome to apply if you're finishing up your undergraduate degree right now. That's totally fine. I see a question from Bailey about, as an MS-PhD candidate, currently undecided about pursuing a PhD. What do most MS-PhD students do after graduation? Do they switch paths to pursue a PhD, or do they wait a few years? I think there's a mix. We do have people who will go straight into a PhD program. From our May graduates, I know that we had at least a couple of people when went to Harvard, one was admitted to UNC. So that does happen. My personal recommendation, and this is just my personal recommendation, is that it can be really beneficial to get some work experience in between a master's degree and a PhD. So many of our graduates do go on to work for a bit, even if they are considering a doctoral degree eventually. And we do have students from the MS-PhD program who continue working for the organization where they completed their field placement. So that can be a really nice transition into employment. But it's a huge variety. We do have an alumni page that gives you a sense of where some of our alumni are, and we can send that link out as well. Emma, you asked, you have 1 year of work experience. Am I still eligible to apply for the MS-PhD program? Yes. For the MS-PhD program, you do not need to have any full-time work experience. We welcome people who are straight from undergrad or finishing up undergrad. I think I answered that question about needing a master's for the PhD. It's not absolutely required, but typically students who enter the PhD program will have a master's. This is a great question about if you are interested in the PhD program. Do you need to secure a potential supervisor? You do not, and you're not expected to do that. So we are not a traditional apprenticeship program where you need to like reach out to faculty and identify a supervisor and a dissertation project before you're admitted. That's not how things work in PFRH. We look at our PhD applicants and select people to enter the program who we feel are the best fit for the program and with the department broadly. And then we will match you to an advisor once you accept admissions to the program. So we'd love to see you talk about faculty who you're interested in working with in your application, but you don't need to contact faculty ahead of applying. Let me turn to some of our raised hands. Emma?
Hi, thank you so much for answering my question previously. I have a question about like the field placement. I'm interested in MS-PFRH program, and you mentioned about we have a matching mentor or like professors throughout this like academic experience. I wonder like how's that related to the field work placement? And the second related question is like, how is the career service and the Loop network will be helpful after graduation? Thank you.
Thanks. Yeah, so I think the first part of your question was about advising. So all of our master's students, we do a group advising model. And so we take groups of like 8 to 10 students and match them with one advisor. And so you would receive advising from that advisor in a group setting and also one-on-one if you would like. We have a master's seminar for our first year students. And a lot of that is in the beginning of the year, kind of getting oriented to Hopkins and to the department, doing course planning. And so we have these large sessions with all of our master's students. But then twice or about once a month, the advising is the small group advising sessions where students meet with the advisor. And I think our students have enjoyed that model because you benefit not only from your advisor, but from your fellow students who are in the group and might have similar questions or questions you might not think to ask. And I think a lot of those groups have really gelled and support each other. And then the second part of your question was about like career services. So actually, as part of that seminar, we have an Office of Career Services here at the School of Public Health, and they come and do several sessions in that first year, talking about things like building your resume, building your cover letter, thinking about interviewing. We provide support during that seminar about the field placement search and identifying field placements. And so it is up to the MSPH student to apply for and identify your own field placement, but we do provide a lot of support as you're making those decisions and thinking about possibilities, and eventually, deciding what you're going to do in that second year. Cecily?
Yeah, thank you. I had a question about what you would recommend. I'm coming in with a master's in communication, and my thesis was related to health communication and contraception use. I was curious if it would be beneficial to apply to both the MSPH and the PhD in the event that my previous education is like not enough public health experience to get into the PhD, or if it's really just a toss up either way.
Yeah, that's a great question. So on the PhD application, you can actually check a box and ask to be considered for a master's degree if you are not admitted to the PhD program. So I would say my recommendation would just be to apply to the PhD program and make sure that box is checked. And we have great system so that if for those who apply to the PhD program who are not admitted, they're automatically sent over to the master's admissions group, and we would consider you for the program then.
Wonderful. Thank you so much.
Yeah. God's prescience.
All right, thank you very much for your time, Doc. So I would like to ask, can I apply directly for the PhD program with my BSc in public health?
I'm sorry, I didn't quite get that. Could you repeat your question? Can you apply to the PhD program? I think we might have lost you. If you want to put your question in the chat, I'll look for it there. I'm not sure that we're going to be able to get through all of these questions, but I'll do my best in the next 5 minutes, and then we'll share some contact information if you have questions after that. So I see a question about PhD prelim exams. And so the process for those is that you develop a proposal, and it's an exam committee that you and your advisor choose. I don't want to get into too many of the details at this point, but just know that if you were admitted to the PhD program, the department and your advisor really help guide you through that process. And essentially, it's just to make sure that you have that final approval from and confidence of a team of professors here at the school to engage in independent research and turn to your dissertation. I see a question about whether international students are eligible to apply for the need-based scholarship. Yes. So when you submit your application, there's you'll submit some financial aid information, but we do consider international students for the need-based scholarship. I see a question about contacting faculty that you want to work with before you apply. You don't need to do that. You can, but my recommendation really is only do that if you are not sure whether the department is a good fit for you, and you need clarity on your end. We are not expecting that all of our applicants will have been in touch with faculty here, and in fact, it's hard for our faculty to manage the number of requests, so don't feel pressure to do that. If you are interested in meeting about the PhD program, I would recommend reaching out to Gilbert Morgan, and we'll share his contact information. He wasn't able to be on the meeting today, but you could contact him. We do not require the GRE, and you do not need the GRE to qualify for scholarships. I see a question about recommending work experience prior to applying to the MSPH program. You don't necessarily need that. A big component of the MSPH program is completing the field placement. And so we understand that you might be fairly early in your career and gain that experience while you're here. So it's not a requirement for the MSPH. Again, you don't necessarily need to have a master's degree to apply to the PhD program, but our strongest applicants typically do have a master's. I would list as many faculty in your application that you would like who align with your interests, but don't go overboard. We want to see that you have done your research and you're serious about the faculty who you list in your application. I see a question about the biological sciences course required to apply for the PhD. I think Kristen might be able to best answer that question. I would say, yeah, we could answer that via email. We do not require the GRE for any of our programs, so you can submit the scores if you would like, but they're not required. And then in terms of admissions, we this year have about 4 slots for the PhD program. So again, very competitive. Last year we had over 100 applicants for 4 slots. But that for the MSPH, we typically bring in between 30 and 40 students. Again, decisions are made on a rolling basis, so apply early. But we don't have that same, we're not constrained in our master's program in terms of number of slots the way that we are for our PhD program, so would encourage you to apply. Amara, would you like to come off of mute?
Yes, hi. Thank you so much for taking my question. I have a specific question about the Bloomberg scholarship. I attended multiple seminars. The reason is I work with a non-for-profit organization, but I have read all the answers of Bloomberg scholarship, and I wanted to know if my organization has to be part of that study in order for me to apply for that scholarship, or let's say I apply and you will enroll me into any program. I work in a non-for-profit pregnancy center, so I have my background in healthcare and reproduction, so it really fits into that adolescence healthcare and reproductive thing. I work as a sonographer and I have a medical background.
So are you interested in the Bloomberg Fellows program?
Yes, a master's through that.
Okay, so that's actually with that's for MPH students, and the MPH
Yes.
program is a school-wide program. Our department does not administer that. We're not in charge of admissions for the MPH program. So I think I would recommend reaching out to the MPH MPH office. Sorry, that I can't help you.
Okay, sorry about that. I thought it's the reproduction part of that program. I joined the seminar late today. That's why I did not know.
Oh, okay, no problem. And if you can't figure it out with the MPH office, feel free to reach out and we'll connect you.
Okay, thank you so much.
Yeah, so it is 12 o'clock. I don't think that we're unfortunately going to have time to get to everybody's questions. I hope that we answered a lot of them, if not most of them today. We will send out the recording to this session, and we do have contact information on the website. So if you have a question that we did not answer, please feel free to reach out and check out our website. We have a lot of great information up there. But really want to thank you again. It was a pleasure spending the past hour with you all. Hope that you apply to join us here in the department. And yep, feel free to reach out if you have any questions. So thanks so much, everybody.